everyone to this Fuse quarterly research meeting where we're going to be discussing how to develop meaningful integrated approaches between research and practice to address health inequalities in early life. And we have, sorry, it's not working. So here is a copy of the program. So we are going to have 3 speakers, well, actually 4 speakers, sorry. And then we're going to also have a breakout session. Okay, so here are just some rules of engagement. So can you everyone make sure that their microphone is on mute and that it remains so unless you're specifically invited to speak. And please as well stop your own video to help with the streaming quality. But when we have the breakout discussions, please feel free to both unmute yourself and to turn on your video. And during the presentation and the question and answer session, please type your question in the chat box and we'll manage to read them and put the questions to our speakers. And if you feel that someone is not behaving appropriately, please message Cheryl Wisecoat. Okay, oops, that's the breakout room. So now I'm going to stop sharing and welcome our first speaker. That is Dr. Ian Robson at Northumbria, who's also the impact lead for the ARC Young People and Community theme, as well as he is part of the Kernel Research Collaboration. Now over to you, Ian.
Thank you very much. I'll just grab a second to make sure that all of the my screen can be seen. And let me just check in with you first to see that you can see that. If I've not met you before, it's really good to do so. I just want to start things off quickly because there are so many interesting things on today's agenda and I want us to be able to get to those. It's my absolute pleasure just to share a few, let's be honest, personal reflections, wearing a few different hats. One of the absolute pleasures that I have is talking to a wide variety of practitioners and researchers across our region when we're talking about health inequalities, children and young people. And in particular, some of my conversations that I'm just going to reflect on right now are with our local authority partners, particularly where we have looked to connect the worlds of health research and practice in social care even more effectively. We're really interested, aren't we? I guess we all are, that's why we're here. We're interested at that interface and how those two worlds can come together even more effectively to promote work that reduces health inequalities. So I just want to give you a few themes. And if you can see my screen, you can see that there's sort of 2 halves to it. One is a set of themes, I guess, which have come up as I've talked to senior practitioners, community practitioners, heads of children's services across our region, where we're all grappling with similar themes, whether we are practitioners or whether we are researchers. So I said, that speech bubble, if you like, about ambitions is at the headline level of things that many of us, words that many of us use on an everyday basis. And I'm convinced in all of the meetings that I'm in that people are passionate about these sorts of themes, that we are wanting our services and our research to be relevant. We're wanting services especially, but also research to be responsive to people who we're working with. We're wanting to be inclusive and to really think and challenge ourselves about our existing practices and our habits, habitual ways of doing things. We're also wanting to do things in a way that are sustainable. And that's certainly conversations that I have regularly as services get squeezed in terms of resources. And as researchers, we always want to do more than we have resources to do. So those ambitions are really driving us, and I think they are a shared thing that we'll pick up today in this quarterly research meeting. And one of the other contexts that I think might just seem obvious to all of us is that we are working in complex and dynamic systems. So things happen in real time and we want to respond in real time. We're always in conversations, probably why we're on Zoom meetings for too many hours a day. And we're becoming less interested in still snapshots and audits, although they are still important. And we're becoming more interested in understanding patterns, understanding where the learning is, and sharing that learning. And then that third theme in the conversations that I picked up certainly has been about really wanting to work in a way that is enabling, and that is evident in the conversations that I have with local authorities, within the ARC, in Fuse. We're wanting to work in ways that we form trusting relationships with people. So that's not just a wafty aspiration, that is the basis on which good practice and good research is conducted. Well, I'm using a weird word here, it's probably my word, activation. What I mean by that is, rather than having a blueprint and then expecting just to mindlessly duplicate something, whether that's a practice or a research model in our region, we're wanting to inspire others and to be a catalyst for other people's activity, so that a response in Stockton is different to a response in Cramlington, and that's different to a response in Heaton, because they're responding to local populations, local communities, and local concerns. So, and we're wanting to embrace and really welcome difference. We're very mindful that some of the ways that we practiced and researched in the past have oppressed different groups, and so we're wanting to be really mindful of that. We're wanting how our practice and our research develop to change and to step up. So very quickly, on the other half of my screen, if you can keep up with me, 3 things that are, I'm not saying they're sort of finalized, I'm not saying this is a plan, but certainly in my own reflections on the conversations about where do we go from here. One is, and I'm using probably quite an awkward phrase here, better formulation. What I mean by that, better ideas, better concepts, better ways of thinking about things. Sometimes we, whether it's in practice or research, we don't take enough time to carefully say, what is it we're exactly interested in? What is the change we're looking to make? And doing that in ways that are inclusive. So, for example, having better indicators of need and of progress that reflect children, young people's, and parents and carers' views. So we're formulating needs without creating templates. We're saying, here's the issue, but how you enact it, how you get on with it in your area may look quite different. By better diagnostics, especially with our local authority partners, loads of people are doing work on how do we better understand what's going on in situations, because we've shifted our unit of analysis just from the individual child, the individual family, and we're wanting to say, how have things come to be the way that they are? If we're going to look at inequality, if we're going to look at these sorts of themes, that is certainly something that we're all considering, researchers and practitioners alike. And lastly, and maybe this is an obvious title, there's so many conversations that all of us are having about better action and how we can really operationalize and implement some of our language around co-production, around diversity, around inclusion, around reducing inequalities. And that's the really interesting conversations I hear in the region at the minute, where researchers and practitioners can come together. And that's where the real productive discussions are about saying, okay, let's have the clarity on concepts and approaches, but let's also make it real. Let's also translate it so our practitioners, our frontline workers, families that we're working together with really are able to focus and engage meaningfully in studies, but also in services. So I know that's a real whistle-stop tour, but I hope that in just sharing a few of my personal perspectives that I've had the real pleasure of picking up when I've been talking to you and other colleagues, you'll be able to see these sorts of themes in today's meeting.
Excellent. Thank you very much, Ian. And so just to remind everyone, oh wait, I should probably just show myself. Sorry, just to remind everyone that if you have any comments or questions for Ian, just please put them in the chat and we can discuss them during the Q&A session. And next up we have Ruth McGovern, who is a lecturer at Newcastle University, and Anna Christie, who works for South Tyneside. Over to you two.
I am looking to Ruth to see.
Yeah, sorry, I'm having a little bit of difficulty. We did practice this as well. I had a little difficulty because I shared my screen before I took my mute and my camera off, which meant I couldn't then unmute myself. So, right, let me take you back to the beginning and then I'll hand it over. There you go. Probably shouldn't have put me in charge of the technology, Anna.
Okay, so I'll start. So we're talking about developing research collaborations and capacity in local authorities, and kind of round with the example of the Best Start in Life Alliance evaluation that's taking place in our area. You want to go to the next slide, Ruth? Brilliant. So I'm just going to provide a little bit of context about how kind of our working relationship started. So the Best Start in Life Alliance evaluation came about from the call that went from the School of Public Health, the Practitioner, the Public Health Practitioner Evaluation Scheme, the FED scheme. I mean, I don't know of other people's experience of this because it was quite a competitive scheme, but I thought felt it was quite a good approach to engage people in the local authority who were kind of thinking about evaluation and research further. So I kind of tasked my team to kind of put forward multiple suggestions, and then working with Peter and others at Fuse came up with a kind of a package of work that could be evaluated. So there was 3 interventions that actually sit underneath our Best Start in Life Alliance, and which we felt that were naturally suited to a wider evaluation, which we worked up with the research team to put forward an application. So the alliance, the Best Start in Life Alliance itself is one of many in the South Tyneside, and it's a particular way of working that we have across the health and care system. So it's multi-agency organisation and multi-teams coalescing around particular themes. So this one on the Best Start in Life approaches, and underneath there was 3 interventions that were going to be case studies. So our health ambassadors and mental health networks, mental health champions network, and also the Best Start in Life locality hubs, which is bringing together multiple teams into kind of co-locations. There's obviously been challenges with COVID, but the kind of genesis of this evaluation, this 2-year evaluation, means there's been a lot of new people engaged with research in the local authority, you're participating or kind of raise awareness of it. So I'll pause there. Is there anything that you think I should add, Ruth?
I think that's fine. Yeah, is that me then?
Okay. Yeah.
Okay, so I wanted to talk to you a little bit about some of the benefits of working with the local authority on this particular project, as well as to talk to you about how we're using Best Start in Life Alliance evaluation in a small way to contribute to the aim of building a research culture within local authorities. Now, whilst I will be discussing this specifically in relation to this project, I'm also wanting to present this due to another capacity that I have. So I have a substantive role with the North East North Cumbria Clinical Research Network, and also a role within ARC as the lead for social care research. And the approach to influencing research culture that I'm presenting today is also one that we're taking and applying within the social care setting also, in regards to the NIHR's expansion project to build research outside of NHS settings. Okay, so I guess one of the first things I wanted to reflect upon today was just the benefit of working with a local authority or other providers in doing research. And I guess the most central and also potentially obvious one is that if you work with the receivers or the producers of knowledge, if you work together, then it's far more likely to result in better research. And by that, what I mean is research that is going to be relevant, it's going to answer the right questions, Some of the times the work that I'm involved in is around intervention development. But if you develop an intervention for things that aren't really a priority or aren't really important, or you do it in a way that's going to make it really difficult to implement, then the research really isn't going to be feasible. So with the Best Start in Life, I guess one of the things that's been really important to the project is the fact that the question came from our public health colleagues, and it was something they wanted answered. And as a result, hopefully, what we gave is something that they can use and that can actually have, therefore, an impact upon the services that they provide. And by that, I mean having an impact in terms of better care and better systems that hopefully will improve outcomes for the people who use those systems. But there's also another benefit, which I guess teeters more towards how it might contribute to a research culture. And that is that it could actually help to win the hearts and minds, I guess, of people who are otherwise incredibly busy doing jobs which feel a far greater priority to them in their roles, and find it quite difficult to find time, space to consider, contribute to, or even use research some of the times. So the fact that this research project was a collaboration between practice and research, hopefully therefore makes it much more likely to lead to positive engagement with research in future. But we also know from research in health that practitioners and people within a local authority or other settings could potentially have a better career as a result of their involvement in research. So we know that opportunities in health to do research are different, that there are more of them. But also those that are involved in research are more likely to be retained in their work. So there could be some real benefit in terms of this collaborative approach, and also hopefully building a research culture. The other thing I wanted to talk to you about that we've been doing in Best Start in Life, that we've also been doing in some of the social care settings, is trying to develop research capacity within that setting. So specific to the Best Start in Life project, we currently have a School for Public Health Research launching fellow who has been working with the team actually since the inception of this project, and really learning the craft of research by being involved as an integral member actually of the team. And her plans are to begin to apply for fellowships, apply for doctoral research opportunities as a result of this experience and some other experiences that she's had within Newcastle University whilst undertaking the launching fellow. I've also been supporting a public health colleague within the local authority in South Tyneside to apply for an NIHR pre-doctoral fellowship. And the idea with both of these opportunities was very much that these individuals would work within the Best Start in Life project, would have the opportunity to be kind of embedded in a research culture, to learn from that, but also to get that really hands-on opportunity for learning that you tend not to get, hands-on learning about research specifically, that you tend not to really get in a busy local authority setting. The other thing that we're doing that is happening in South Tyneside, linked to the Best Start in Life Alliance, but also that we're doing in various different social care settings, is that we're looking at trying to embed a researcher into the setting as well. So the previous example of development capacity was very much about somebody leaving the local authority, leaving that situation, coming into the university and using a project like Best Start in Life as a vehicle to get involved with and get your hands dirty with research. This is kind of the alternative, the exact opposite model, where we're sending somebody who already has research skills into an environment that hopefully they know a bit about, public health setting, or in the other example, social care, and that person taking their skills into that setting, learning about the setting, being sensitive and appreciative to the setting, but taking with them their skills and therefore being able to use those within that kind of very applied situation. And I guess I also noticed Mandy, who was the author of this paper along with Peter, is one of the delegates today. And Mandy, of course, was an embedded researcher in Gateshead public health team some time ago, and she wrote this great paper which really talked about the strengths, the benefits of the embedded researcher role, and really what that can bring to the environment that person's within. So really what we're hoping to do through Best Start in Life is to benefit from the embedded researcher model. I'm going to introduce Meg Logan to you in a moment, and Meg's been funded, she's employed by the QRM to work into South Tyneside, again as part of the expansion scheme, and Meg's going to be very much supporting the Best Start in Life project and its delivery, as well as many other things, and really giving us the benefit of all of the things that she brings to the local authority, and the conduit that she is between research and the local authority. So I'm going to pass you over to Meg and invite Meg to switch her camera on and say hello, hopefully. Meg, are you there?
I am, sorry, I'm just having difficulty putting my camera on. Okay, hi, sorry about that. Hi, so as Ruth says, I'm employed, I'm currently working with South Tyneside Local Authority within the public health team, but I am seconded from my role in the CRN, the Clinical Research Network. So I've been seconded for a year to work in collaboration with South Tyneside Local Authority to encourage and hopefully promote research within non-clinical areas. So this will include identifying the current work practices and provisions already in place, and how we can build on this and extend the opportunity and provide more support for staff and residents to take part in changing their future for the better. So obviously my main aims are to develop research in the local community, to identify underrepresented populations within the local authority, to work with them to improve their health and well-being. This is particular targeted populations, people who ordinarily wouldn't get their voice heard. Identify skills and knowledge within the current workforce. As Ruth says, anybody who would be interested in, who has already taken part in research, maybe did it part of the training, would love to be a part of research but just doesn't have the capacity, or would need some time, some support, and going forward it would free up them a little bit to be able to do that, and also to bring research opportunities to the community instead of the community coming to the research. I do think, coming from clinical research, we've got a very small audience when it comes to research. I think majority of the people that need to be involved, or that could be involved, or given the opportunity to be involved, are actually in the community and not based in a clinical environment. Thank you very much for your time. Thank you.
Okay, thank you, Ruth, Anna, and Meg. That was a great presentation again. If anyone has any comments or questions for any of the three last speakers, then please do put them in the chat box. And next up, we have Zoe Bell, who's a PhD student at Newcastle University, and Emma Gibson, who works for Gateshead City Council. So Zoe and Emma, over to you.
Thank you, Heather. So our presentation is going to discuss the value of a partnership approach from the perspectives of me, a PhD student, and Emma, a public health practitioner within a local authority. And we'll touch upon some of the potential challenges and values of, well, throughout this presentation. So I'm a third-year PhD student from Newcastle University, and my PhD is a collaboration with the public health team at Gateshead Council, and it's exploring the nature of food insecurity and its nutritional impact amongst women and children. And the original project was using a partnership approach and using an embedded researcher or researcher in residence model. So using the embedded researcher approach, we hope to facilitate the co-production of research that was sensitive to the local context and in line with the priorities of Gateshead, ultimately to help make improvements for the women and children who are unable to sufficiently access healthy food within the borough. So food insecurity is an issue that's gained increasing attention in high-income countries since 2010, both from academics and media as a major public health concern. And we've seen this during the pandemic with campaigns such as Rashford's free school meals. And it's an important issue, given that we know that differences in the ability to access healthy food and differences in what people eat across social groups can affect health and well-being and contribute to health inequalities. And this is tackling health inequalities and addressing food insecurity is something that Gateshead Council as a local authority are invested in. And these are just some of the images from one of the services offering free food aid that I visited during my research.
So I'm Emma Gibson, as Zoe mentioned. I work within the public health team within Gateshead and lead on the area of healthy weight and wider determinants. So I'm very much going to talk about how Zoe's work very much fits into Gateshead's priorities and what the collaboration was like from a local perspective, and a little bit about that partnership journey as well. So Zoe's work very much fits, as I said, into our Thrive kind of council priorities. And we know within Gateshead that early life nutrition and food insecurity are really important factors in the development of obesity. And we really recognise that it's an important sort of area for both research and public health practice. And I think as an area we recognise there's lots sort of a wealth of research already kind of documenting the consequences of growing up in poverty, including kind of on children's life satisfaction, health and well-being. But we really wanted within Gateshead to build this into the research locally and to inform our local practice. So very much the picture in Gateshead is similar to other areas in the region. We know that there's huge challenges in terms of food poverty and health, and with families living in deprivation. And again, this has been exacerbated in terms of COVID. Within Gateshead, we've got 1 in 5 children living within poverty, which is equivalent to 22% of our population. And we know that nearly 21% of children under 16 of families are classed as on low income, which is a huge number. Our obesity rates in terms of our National Child Measurement Programme for reception and Year 6, again, are over kind of the national kind of prevalence levels as well, and are both high. So we know that there's kind of huge challenges ahead. Gateshead, I think, as a council, has always been really ambitious and has kind of a reputation for innovation in terms of kind of our economic sort of regeneration and culture, and sort of putting Gateshead sort of firmly on the map. And I think as a council, and definitely as kind of a public health department, that we realised that we had to work a little bit differently. And there'd obviously been, 10 years of austerity and government major reforms and policy changes in terms of kind of housing reforms, etc. And we knew that in terms of tackling health inequalities and addressing this kind of food insecurity theme for Gateshead was something as a local authority we were very interested in as part of our kind of health inequalities agenda as well. So as I said, the focus on Gateshead is very much as Thrive, as it's kind of the forefront of all of our work, and very much kind of the early years and best start in life agenda is a priority about putting people and families at kind of the heart of everything we do. Very much the collaboration with Zoe has allowed us to really focus on the collaboration, on the priorities, for Thrive, and make sure that we're really kind of targeting our resources at those that most need them in the council. The council, I think, like most other public sector organisations, and obviously I don't need to tell you, has kind of had reduced resources, and there's very much an increased demand for our services. And as a council and public health team, we know that we're not able to meet the needs of everyone, and we have then looked about shifting the focus to some of those onto the most vulnerable groups and those that are most kind of in need of our help to thrive as well.
So on this slide is a diagram of the embedded researcher or researcher in residence model. And this model is a way of working to co-produce knowledge that can use a wide range of different academic approaches, but for the PhD, we were using an ethnographic approach. So the orange box highlights the first stage, which was either a scoping or introductory phase. And then the green boxes highlight the phase that the PhD moved into. So we had planned a 12-month ethnography and then in-depth serial interviews with women who were accessing the food aid services. So the stage 1, the orange box, for me was a period of 4 or so months where I was co-located and fully immersed within Gateshead Council. So 3 days a week at Gateshead and then 2 days a week at the university. And this was for me to learn about Gateshead Council's priorities, how they make decisions and use evidence to inform policy. Then also to understand Gateshead as an area, their food aid system and wider networks, and then build relationships with people within those networks. So the scoping phase really helped me build relationships and then find a setting to carry out a 12-month ethnography as a researcher volunteer within a food cooperative in Gateshead. Unfortunately, COVID had other ideas, which, I haven't been able to carry that part out. But the rest of the presentation will talk about the values of using this approach and from both of our experiences.
So I'm just going to talk from a local authority perspective in terms of, I suppose, what the collaboration and what Zoe in her embedded role and some of the changes that have happened sort of due to COVID. So the benefits from a local authority perspective and linking with Zoe in terms of her collaboration and PhD were very much in terms of the council wanting to look at sort of innovative research. And I think there's kind of a recognition for local authorities to support new ways to tackle kind of wider determinants of health and just new ways of doing things as well. And for a council, we were keen not to just to keep doing what we've always done and be a little bit more informed, I suppose, about some of the challenges facing local people and to generate and co-produce more solutions and learn from kind of that lived experience as well. Our DPH within Gateshead is really, I suppose, keen and quite brave, I suppose, to try new things out, new approaches. And we'd had a really positive experience with the embedded research that we'd worked within with our team. Some really, really good outcomes for the team and for the work as well. So it felt really just as a bit of a natural progression in working with Zoe on an area that was a council priority for this area of work. It very much, as I said, aligns with our priorities that I've covered with our Thrive agenda, but also not just for Thrive, for wider areas of the council in terms of our children's system as well, and linking with our healthy water agenda in terms of whole systems and sustainable food cities that we were looking at across the board, and very much links in with the previous embedded research work around universal credit as well. It very much kind of, I think, informs and the hope would be to kind of inform some of our decision making as well. So it fits, as I said, with the council priorities, but also kind of to influence future work programmes across the council and potential kind of future commissioning priorities and programmes as well. I think it really challenges as well the ways of working and approaches, as I said, and some of the sort of potential barriers that exist in traditional research projects. So instead of parachuting into projects to do sort of a couple of months of sort of manufactured focus groups and writing up the results, it's very much about being embedded within the work, within the community. And I know this has changed slightly with a little bit of the focus with COVID for Zoe's work, but that's very much kind of the ethos behind this. And I think as an organisation, we felt that sort of a holistic, non-judgmental approach and community-focused ethos with sort of clear leadership behind that, underpinned by some of the clear values and principles, could support some of the system-wide work going forward within Gateshead as well. I think a key part from a local authority perspective, and probably from Zoe's as well, is that connection and trust. So Zoe very much sits as part of the team. It's kind of reciprocal arrangements in terms of the learning that we've got from Zoe, and hopefully the learning that Zoe's got from the team. Very much Zoe's seen as kind of an expert in her area from the public health team. So there's lots of obviously queries to Zoe in terms of some of her work. But she's very much fitted in. I think that's based upon kind of the trust, which was kind of established at quite an early stage as well. And I think that trust kind of relies on, between the collaborative partners, a willingness to take a bit of risks as well, because obviously the outcomes are unknown, and it's kind of, as a local authority, maybe unintended sort of consequences or unclear at the outset. But from a public health point of view, I think we were really clear from kind of the outset, clear sort of communication as part of the collaborative, about allowing sufficient time to explore values and principles kind of underpinning the approach was really important as well. I think just having, the expertise of Zoe, and through a different sort of viewing things through lived experience, kind of a fresh set of eyes as well. So we're very much aware of the benefits of an embedded researcher within Gateshead, and the team felt that the role did provide a neutral and an independent kind of fresh set of eyes. And it was just kind of the additional research capacity that Zoe's brought to the team. And colleagues, I think, within our public health team are very much viewed Zoe as a colleague rather than an external researcher. She's come to become kind of part of our public health team. And I think kind of the inherent probably skills and knowledge of Zoe as part of her collaboration and her ability to kind of link with other researchers across the learning has brought great wealth of knowledge to our team as well. And just lastly, I think it's about having, shared space and the right person. So Zoe is very much kind of, as I said, fitted into our team perfectly. But I think it's obviously, it's a huge learning curve coming into kind of a new organisations with lots of different processes and often bureaucracy, and probably even more challenging in terms of COVID. So Zoe has been embedded within the council and our processes as we'd hoped, and hasn't been able to come in the office.
Okay, so now the values from my perspective as a PhD student. So one of the values was being, and I thought was key, was being fully immersed in the public health environment and being physically located in the public health team in the Civic Centre. I had my own desk space, IT login, I was operating as a staff member, and I was able to attend public health team meetings. And then once I was settled in a little bit, actually present at those or kind of provide updates and get feedback, which was really valuable. But then also listening to the conversations that were going on about ongoing projects or campaigns, and just kind of learning the language that was being used. And this really helped me to understand where the PhD sits in the wider context of public health, but then also Gateshead's priorities. Another value was the rapport and the relationship. So in the first month that I was embedded, Emma acted as my champion at the council. So she'd set up meetings with all the different public health team members of staff, and then any other local authority staff who might have an interest in the research. And this was great because I got to meet different people, and actually it led to a bit of a snowballing effect where I was then introduced to other people, invited along to meetings like the Gateshead Community Food Network, and just get to understand the different perspectives on food insecurity, on poverty, and increase my network. Another value was getting to know Gateshead. So members of the neighbourhood team kind of took me out and introduced me to people in the areas that they worked in who were linked to my research, so that I could get, again, more introductions, but this also helped me to understand Gateshead at a more physical level. But then also being embedded meant that I was able to access the public health team's shared drive and speak with the team's data expert and kind of map the services offering free food aid in Gateshead. And all of this kind of helped shape the research. And then non-specific PhD experiences. So I found a value, but also a challenge was during this kind of scoping phase, was at times I felt kind of a bit of a tension or this boundary between being an academic researcher, but also having this professional identity. The team was so welcoming and I was there 3 days a week. And I think perhaps because I was a PhD student in my first year, I sometimes felt a little bit of isolation from the academic world. But to overcome this, there was better communication with my supervisors. We had more regular meetings, more regular email updates, which really provided me with the support that I needed. And then also, because I was working alone, actually maintaining like a research diary really helped and was really valuable in helping me process the thoughts and all the experiences that I was having. But yeah, the value of being embedded and having that professional identity meant that I got to experience lots of different things and gain transferable skills. Like I was able to facilitate at the Healthy Weight workshop on implementing a whole systems approach, and being part of a team initiating and writing a business case that was linked to access to healthy food in Gateshead. And that was really enjoyable. And again, kind of gave me a perspective of public health as a whole. So moving forward, we've had discussions about how we can collaborate moving forward and use the vast knowledge and experience of the public health team moving on in the projects that we've got. And then just a summary.
Yeah, so just to summarise, obviously the research will provide the opportunity to hear from communities and that lived experiences, which we know within public health research we often want to do, but haven't got kind of the time and resources sometimes to do. So that's going to be really useful in moving forward to kind of inform some of our policy and practice, not just within public health, but also wider as well. We know that it kind of provides the potential for new sort of methods to reveal perspectives as well, which we're not able to kind of access through our sort of local data sets that we have available within public health and the local authority as well. I think Zoe's role as well has just enabled her to gain from a range of sort of professionals from the council, but also wider. And I think it's very much kind of Zoe's work's kind of I think helped other sort of council staff and other partners realise, I suppose, the capabilities of research, and it's not just universities that we can embed people within the council and other organisations to take forward work from a more collaborative point of view as well. There's very much kind of shared learning that we're going to translate into public health work, and the ultimate goal is the sort of the Thrive principles that I showed at the start. Is that we can kind of embed that and use that as kind of a lever, some of the research findings coming through to take work forward. And hopefully this is just really a starting point for future collaborations. As I spoke, we had Mandy, who I think's on the session today, as an embedded researcher before, and I've had just a really, really positive experience in the collaborations that we've had with the universities. And I think from what the public health team has learned in terms of the partnership with Zoe has just been really invaluable up to this point.
Thank you, Emma and Zoe. That was perfect timing. So now is time for the Q&A. So if I could ask all speakers to turn their videos on, and I see we have a few comments in the chat. And as well, if anyone else has any comments, feel free to either just turn your video on and shout or raise your hand. So just looking at what we have, so we have Ian who said that was really interesting to hear about bravery and openness, and this was to Emma and Zoe's presentation. To new thing, openness to new things is important. And as well, Peter made a comment about how to manage professional identities across boundaries as academic researcher and public health professional. And he put a link to a paper from a nursing perspective. And I guess as well, if any of the speakers have anything that they want to further mention, comment, or any comments to those comments, just feel free to start talking.
I think that's an interesting point from Peter, and maybe we could direct that to Ruth, who has both a professional kind of role as well as the academic role and then trying to blend those things. It would be useful to hear your view, Ruth, on that.
Sure. I mean, I guess one of the things to say straight away from my point of view is I used to be professional and now I'm a researcher. And I guess I had to leave one behind in order to come to another. And that wasn't because it's not possible to manage both identities. It's not that at all. In fact, I think that is absolutely the sweet spot if you can do both. The thing about why I left social work as my profession was and came into research was because you couldn't do both then. And increasingly there's opportunities to do both. So in the health world, and I think this is kind of what I was trying to touch on in my introductory presentation, if you like, was in the health world, you can do both, and it's very usual for practitioners, clinicians to have research opportunities. In fact, if you want to progress, you need to do research, and there isn't the same research practice trajectories so far anyhow in public health. A bit, I mean, there's more in public health, but there's very little in social care up until more recent times. And we've seen this increasing in the fellowships that I touched on, which is brilliant and a very welcome move from my point of view. But at the moment, there isn't the support for people within public health and within social care to do that research career together. So they're still hitting the same challenges of you either need to leave a perfectly good career and all the good stuff that you're doing in that career to go down to the bottom of another ladder and start trying climbing it again to get into research, or you need to just continue to progress in that area. So what we're seeing more and more and more are these opportunities to combine the two of them. I think the identity is you're perfectly able to be navigated. It's much more about the practicalities of how somebody could be released from their commitments, the responsibilities, particularly in settings. I mean, social care in particular is a very difficult setting to be released from for a couple of days and then go back to, because you've got a caseload, and it's not the same kind of working practices that you have in clinics, for instance, where you have days of the week where you are in clinic, and those are the days that people tend to give up to do research. In social work, you are always a social worker, always arguably available for your service users, and sometimes service users don't like part-time social workers because they're not there when they need them, when the crisis is calling, or when they feel like they need some support. So it's less about the identities and it's much more about the practicalities. And to end on a positive, I always say to people when I talk about why I came into research, I always say I came into research for exactly the same reasons as I went into practice, because to me it is exactly the same. It's about trying to, I'm going to get all soft, it's about trying to make things better for people who are less advantaged. So yeah, I think the two things are very compatible. I think they work well hand in hand. In fact, I think they work better hand in hand. The thing that we need to work out is how rather than, you know, the more kind of why and the identity question that Peter asked. Longer answer than you were probably requesting, Peter, but there you go.
Thanks, Ruth. That's great. We've got another couple of questions in the chat. So Francis Hilliard-Brown says, lovely to hear the positive experiences of embedded researchers in Gateshead. Are other local authorities interested in also using similar approaches, and what might be the barriers be, and what advice would you give them? So I'd hand Emma in the first instance, and maybe Anna could also join in with that from two different local authority perspectives.
Thanks, Nicola. I think, as I said, I think it's that building into kind of the collaboration, that trust, and allowing that openness from the start in terms of there may be some kind of unknown outcomes, and obviously kind of as the research progresses. And I think it's very much about that senior leadership. So we very much had a DPH that was quite sort of bold and brave and wanted to take chances and kind of explain to our members and senior leaders, because they want to know very much about the ins and outs of the research. And we said the research will, you know, be evolving. There's some, you know, unknown sort of outcomes of this, but it will inform sort of practice, and it is from kind of that lived experience. So we kind of shouldn't shy away from that. So I think it is very much about kind of getting that the senior leadership and making sure that it is truly embedded. And all right, Zoe, that collaboration might have changed a little bit, to our kind of own due to COVID, but very much building into the organisation about, I suppose, how that collaboration will work. Will the embedded researcher be based in the office? How much? And I think it is, just as I said, building in that time at the start. So there was lots of time that we built in for Zoe to meet not just public health members, but wider council members, for her to get a real flavour of the landscape of Gateshead as well. And, from a council point of view, what were some of the policies and the bureaucracy within the new organisation. So she really had a feel for Gateshead and what we wanted to achieve.
Yeah, so from my point of view, I mean, we're not looking for to adopt a kind of embedded research model, not for any particular reason, we just haven't considered at the moment, but certainly, I mean, in some ways I've done the opposite of Ruth. I've graduated of Fuse and then gone into practice rather than into research. So I kind of definitely bring the skills that are kind of through my master's and my PhD and kind of applied them there. And then I work with quite a lot of teams within the council and our partners to kind of consider research and evaluation more. And that's definitely kind of been led up to now we've done another NIHR project looking at research capacity more broadly in local authorities, which I'll do a plug for an upcoming Fuse event, which I think the date will be coming out shortly, that will discuss more of that findings, because I think I know there was 2 other projects, but also kind of national pieces of work looking at that. So there's definitely an appetite for more research in the local authority and wider, but again, capacity is probably more of a challenge than we realise. I think there's pockets of skills and interests across the council, and it's kind of understanding how we can harness those and what further support is needed. So I think it'll be interesting to see how things progress with kind of the relationships with the kind of research infrastructure across the region, but also kind of harnessing people beyond the public health teams, because I think the public health teams have more of a kind of research interest and skills from kind of access to the master's programme and kind of push that wider.
Great, thanks. And maybe that's something we can work towards more with Fuse. We'll hear from Peter later about some of the kind of models that are relevant to this, so that might be more food for thought. But I do appreciate as well that the challenges around COVID and where our models worked really well, where the embedded researcher has been part of the team and physically located within the council, but there may be some challenges going forward, thinking about how that would be implemented unless there's change in the near future. We've got a question for Zoe from Rosie Dawson saying, well done, Zoe, great work. What do you hope the long-term outcomes of the project might be?
Thank you, Rosie. Well, yeah, the original plan obviously hasn't quite gone to plan at the moment. But I suppose the initial thing is to reflect on what we've done so far using the embedded researcher role and perhaps adding some learning to that, into that model. And then the project that is ongoing at the moment is kind of an adaptation, is gaining different perspectives, so from frontline workers, about the nature of food insecurity in Gateshead. So maybe from a different angle, still trying to improve the services and resources for women and children accessing food aid in Gateshead at the moment. I hope that answers in some way.
Thanks, Zoe, that's great. That's the end of the questions in the chat. Does anybody else have questions? If you want to raise your hand.
Oh, there's one new one in the chat from
sorry. Okay, great to hear all your reflections. Yes, I wonder how we can manage the challenges of embedded research in community settings during COVID. And so yes, please do publish our experiences of being in embedded research. Or maybe we could go back to Emma on this. Sorry, Emma, you directed everything to you. So thinking about the challenges of COVID and how the council's operating at the moment, learning from what was really useful with Zoe and that kind of embedded nature, how can we continue in the right direction?
Yeah, I mean, I think it's a difficult one because I think there was so much value in terms of Mandy, who we worked with, and when Zoe had started, in terms of Zoe being in the office and just getting to know, obviously, the team and actually how things worked on a day-to-day basis, and that kind of the wider council, and you know, just from a kind of a political point of view, and you know, Zoe would come to overview and scrutiny and different kind of committee meetings as well. But I mean, I think myself and Zoe have kind of you know, had meetings sort of kind of fortnightly to keep in touch in terms of kind of progress, and being able to kind of get in touch with not so much the community at this time, but I suppose professionals, but definitely I think more challenging, and Zoe will say, even in terms of getting in touch with the right professionals. People have been furloughed and are I just think with the local authority, obviously there's kind of a bit of a, there had to be a bit of a response to the pandemic, and there was lots of change in roles. So I think there can be things done remotely, but if it's, I don't know if it would still kind of bring the same wealth of experience about actually being embedded within kind of a team, because I think, you know, there's so much you can take away from that in terms of kind of how teams work and wider local authority sort of workings as well.
Nicola, can I come in there, please? Yeah, I wanted just to flag that I'm responsible for, I guess, the line management of 2 embedded social care researchers who are actually within Gateshead, and one in children's social care and one in adult social care, and they both started in February time of this year, so they well, you know, started the role brand new, well within the restrictions and the remote way of working. And what I would say is that, of course, it is challenging, and of course they haven't had the opportunities that Zoe and Mandy had in terms of just that really informal conversation that we all know really helps. And it's all of the kind of unstructured things that make a lot of difference in terms of embedding somebody. And it was actually a plan that we had for the Best Start in Life project as well, was the researchers were going to be embedded. And unfortunately, those researchers couldn't be, because there was nobody to be embedded with anyhow. They were all doing other things. And what we've done on Best Start in Life, and what we have been trying to do with the social care embedded researchers, is to create those opportunities in the same ways we've all been doing this in our lives, create those opportunities more remotely. And I think what Best Start in Life has given, which we are trying to achieve and learn from in the social care arena, is that kind of vehicle by which, the purpose by which to have the conversations and the meetings and the relationship building stuff. And that vehicle, of course, is the project. It's Best Start in Life. What we're trying to replicate, I guess, in social care is that is those reasons and those joint agendas together to work on a project that is of relevance to the particular setting that they're embedded within, so that those relationships can begin to be built, but at a distance, with a view eventually, hopefully, to us actually sitting in a room together one day in the distant future. So yeah, I think it's not as easy, but there are vehicles by which you can do them, and projects and joint agendas and the joint purpose is, from my mind, one of the ways that you do that.
Yeah, I suppose we've all had to just adapt, haven't we, to the way we do things, and it might not be ideal, but we're finding new ways of working that to try and reach the same goal. If there aren't any more questions, so I've seen Peter's just posted a question. One of the challenges of embedded research during COVID is how to mobilise tacit knowledge online. Any reflections from the embedded researchers?
Just thinking that I think mobilising knowledge across teams has been a challenge pre-COVID, never mind as is now, and there's always kind of a challenge to overcome silo workings that even being co-located physically in a place, it's still going to be a challenge. And I think we do need to kind of think of more solutions to that. And also, I mean, we got poor Meg who started in the middle of the pandemic. I haven't met in person. And we have other members of the team who've also not I've not actually physically met in person. I think remote working is going to be here to stay, at least in some kind of hybrid form. So kind of thinking about how we can kind of overcome these challenges, I think would be really important to kind of progress research further.
Yeah, I agree. Ian, did you want to come in? You've put something in the chat.
Yeah, just to briefly say, I know that there'll be lots of examples that we can give of this, but I know one of the things that COVID has done is it's really stimulated our frustration, but also our curiosity and our inventiveness. So I know in my own experience, which has been similar to others, it's really pushed the development of methods. Now, methods are not all we need. A good method also needs the relationships and and the resources and everything else. But things like creating prototype leaflets with parents has been something that I've been involved with the Kernel Early Life Research Collaborative, and that's been something meaningful that we can, the process of making things, sharing things, showing things, visualizing things is extremely important. And I think it's one of the things that COVID has done in relation to health and well-being research is it's made us so aware of the importance of all of our senses. And, we talked about ethnographic research earlier on, and I think part of our challenge is how do we capture and share some of those details and insights and translate them across different domains of knowledge. So, there's no final answer to that, but I know COVID has really prodded us in terms of our inventiveness in this area.
Yeah, I agree. I'm not saying there's many positives to come out of COVID at all, but it has, it definitely has forced us to think outside the box and reassess how we communicate, I suppose. All right, I'm aware of the time. It's 4 minutes past 2. So I think we probably need to wrap up this session. So I'll pass back over to Heather.
Thanks, Nicola. So right now we're going to have a 5-minute break, and then when we come back, we're going to move into the breakout rooms. So if everyone could please be back at 10 past. Thank you. Okay, welcome back, everyone. I think I still see screens flashing, so I assume more people are coming back. So now if we're going to have, unfortunately, I don't have the list of the breakout room groups, but could we have the note takers from each group and whoever agreed to speak, if they just want to, those people can turn their cameras on and so I can see who that is, and then we'll just go through everyone. So I will just start with Naomi, if that's okay.
Yeah, that's fine. Yeah, so we had a really great discussion in our group. Ran out of time, of course, as you always do in these situations. But in terms of the first question, the first thing we talked about was the difficulties in terms of working across different institutions, and that different research and development departments have different processes, and those processes can have different timescales, and it's quite hard to plan that within your project. And we talked about how within local authorities, there's time and resource difficulties there. So it's very hard for people within local authorities to engage in research, and that's been only exacerbated by COVID and the changing of priorities in relation to COVID. We talked specifically about the infertility team at James Cook and how drastically, well, it was shut down temporarily, if I've got that right, and staff were reallocated elsewhere. So there's a capacity and a priority issue there, and now there's backlogs that we have to get through. We also talked about language as a barrier, something to think about when we're working cross-institutionally and working with different people, to make sure that medical practice people, research people, council people are all familiar with the language that's being used and being very clear about definitions. And we talked about a lack of infrastructure within local authorities, making research very difficult and engaging in research very difficult. Have I run out of time already? Yeah, okay. Well, maybe that's some of the difficulties. Maybe the other groups will tell us some of the suggestions for future directions, and we can feed it back in there if there's time.
Thank you, Naomi.
No problem.
Backwards then, I'll go with Nat next.
Yeah, no problem, Heather. So we also had a really interesting discussion in our group in terms of the barriers and facilitators. I think we possibly talked a little bit more about barriers too, but we talked about the need to understand each other's different roles, to listen to people and have respect for different people's expertise. We spoke about people's experiences of researchers coming into local authorities and sort of saying that or acting like they knew it all and not kind of having respect for some of the knowledge that had been built up from working with communities in local authorities over a long time, for instance. Communication was thought to be key, but there's a need for kind of space, time and funding to recognise that work and the length of time it takes to build trust and develop relationships. People spoke about a fear sometimes in local authorities that researchers might come in and tell people things that they don't want to hear. And again, relationship building was thought to be crucial to sort of overcome some of those apprehensions that were there. And also a need to be brave and kind of open to learn from kind of what we're all doing and what might be working or not working. We thought that there was a need for people to model the behaviours and approaches that you want to see, and co-production of services and approaches was thought to be really key. There was a feeling that people tend to ask for things from local authorities that actually aren't gold toilets, if I've summarised that right from the quote, but that actually local authorities can sort of respond to. There was a need for permission to cross boundaries, be curious and try new things. And in terms of opportunities for future directions, people felt that the integrated care system had been an opportunity to get lots of different people with different roles around a table to sort of work together, and that there was a need to sort of promote examples of where collaboration can work, so people might not think to sort of use collaboration as an option, and there was a need to sort of share instances where that had worked and what the benefits were to that. And I think that's kind of everything that we talked about, but people can chip in if I've missed anything.
Excellent, thanks, Matt. Leslie?
Hello. We spoke quite a lot about the barriers being context related in terms of building up trust and finding out about the politics around the situation. Senior level buy-in as well was talked about, where it doesn't filter down to where the embedded researchers are, those that are directly involved in the host organisation. So there's a bit of negotiating and thinking about that. Getting others to see that research can actually improve practice. And as everybody else I think has mentioned about the time that building up these collaborations and relationships take, again, is, you know, it's seen as really important, but it's not always available. We also had talked about the facilitators of it, so having shared purpose and clear expectations from both organisations, or the many partnerships of what was needed, and understanding as well where the team is in terms of the dynamics of the team and where the team wants to go. We also talked a little bit about the experiences and the, you know, again, learning about the partners' perspectives and taking the time. And we had an example of a local authority internship for a student about capacity building, and that was seen as very sort of beneficial in terms of both the host organisations, the partnerships, and the person themselves, and skill building and in blending the experiences. So I don't know if anyone else in our team, room 3, have got any thoughts they want to add. No, I think that's us then. Thank you.
Oh, sorry, I couldn't undo my mute. Thanks. So now, Anna, did you have anything to add for room 2?
I think a lot of the feedback already has been touched upon in our group as well. We talked about the kind of different language and different definitions from kind of practice point of view, kind of understanding what research is may be different, and kind of building on skills that could be used for research that people may not recognise their research, but they are actually producing new knowledge and kind of implementing that to change practice as well. We also, we did have a final thought, but didn't get a chance to kind of discuss it, but the opportunities from the kind of integrated care partnerships and system may pose a new opportunity to kind of spread research into kind of new settings as well.
So thank you, Anna. And last but not least, Zoe.
Thank you. So our group discussed some of the barriers, and thinking about it's important for academics to think about how they present themselves. So it was shared that there is perhaps the perception that academics are experts and kind of going in with expertise rather than with an idea for a true collaboration. So as an example of a collaborator wanting to meet the team and get a feel for the team rather than the research, just to know that it will be a genuine engagement. Another barrier or thing to think about is the importance of early engagement with an organisation to have a true collaboration that meets the non-academic organisation's needs, rather than going in with an idea. And then some bureaucratic barriers, so in procedural differences between the different organisations, so thinking about ethics or different things like that. And then discussing opportunities for future directions, which kind of fits into facilitators as well. Thinking about the culture that underpins the future directions, so the potential organisations have a shared interest and there's a shared understanding of these different cultures between the collaborators, and then having a real understanding of what the priorities are of the organisation and the expectations. So an example of that would be the timescale. So understanding the kind of reality of academia, which is a bit slower in some of its procedures versus kind of faster procedures in other organisations, and budgets and things like that. So I'm not sure if I've missed anything or anyone else wants to add something to that.
Excellent. Thank you very much, Zoe, and thank you to all the note takers and facilitators for those sessions. And now we're going to be moving on to our final presentation, which is Peter van der Graaf. Peter, if you could share your screen when you're ready, please.
Yep, sharing right now. Right, can everybody see this and hear me? I'll take that as a yes. Yep, thumbs up. Thanks, Heather. So thanks everyone really for those really helpful reflections and comments, and sort of as a way of trying to offer some thoughts on where to go next, in a sense, because we heard some great examples earlier in the event today about sort of collaborative working and how it works, particularly from an embedded research perspective. And then sort of in the breakout sessions, we looked a bit more at sort of facilitators and barriers and how to overcome those. And that's something I've been particularly wrestling with in my own role as the Fuse Knowledge Exchange broker, where we sort of try to develop collaborative research, and particularly with local authorities, because that's where public health moved since 2012, 13. And so what I would like to do is offer some reflections and sort of how we wrestled with those questions ourselves and the models we developed on the back of those, and maybe they might offer some important insights in where to go next. And I will offer some thoughts at the end, and I would welcome your reflections on those yourself. Oh, I've gone too far. There you go. So, but I just wanted to start again with sort of building on the discussion we had in the breakout room, that the barriers that exist to working collaboratively, particularly with local government, and sort of highlight some of the issues that we know all very well. They've been rehearsed in literature and in our own projects, but we know that it's not always easy for policymakers to access research findings. They are behind paywalls in journal articles. They're not easy to understand or apply. And also a point often overlooked, that very different types of evidence and knowledge are being valued by people in local authority, and also by researchers. So things like tacit knowledge and practical wisdom, how do they come into play? And that's because the decision making in local government is influenced by politics, by personal, social and political processes. And so being aware of those processes is very important to understand what evidence and what type of evidence can be mobilized in those decision making. And an important thing that has been touched upon in the breakout rooms is that research timescales often do not align with policy processes. As academics, we're brilliant at publishing our findings once decisions have already been made. So too late, we missed the boat. So how can we do that better? And also what was being highlighted, austerity and public sector funding cuts have been devastating local government capacity and resources to engage in research and evaluation. But on the plus side, we also seen a renewed focus, particularly with public health moving into local government, on prevention and wide determinants of health in other government departments. So there's also opportunities. So I quickly wanted to highlight, there we go, sort of two schools of thought, how you bridge that gap. And traditionally they said there's a way of pushing knowledge out from academia to local government. So it's publishing papers, it's presenting them at conferences, publishing in professional magazines. And then the other side, no, it's about pulling knowledge in. So it's practitioners pulling evidence from academia into their meetings, into their context, into their the decision making. But why can't it be both? So that's a school of thought around knowledge exchange. So how can we sort of do both, push and pull, and have an exchange of knowledge, both research evidence and other types of knowledge? And then you talk about things like co-production, both in sort of research partnerships, but also with communities. And an interesting way of thinking about knowledge exchange and what that might look like is sort of a more cyclical model. And I always like to highlight this example, sort of the knowledge action framework that has been developed by Graham and colleagues, where sort of in the middle you see sort of knowledge creation process. That's where we're good at as academics, where we sort of look at the knowledge and synthesize it and produce that knowledge in tools and products. But there's a whole lot of work going outside that circle that we're often not aware of. And I particularly want to draw your attention to the left side of the figure, where I think there's a lot of work happening in collaborative research, where we're looking at adapting knowledge to local context, where we're looking at the barriers to knowledge use that we discussed in the breakout rooms, and then try to select, tailor and implement interventions based on our understanding of those barriers and local context. And that then leads to new knowledge, but also how can we sustain that knowledge use, and that creates new problems, and that starts a circle again. So one way we sort of try to think in this way within Fuse is develop our own knowledge model, exchange model, where we identified 4 different steps in that process, starting with sort of awareness raising. So how can we make our practice partners more aware of the research that we do? How can we give them access to it in an understandable language that they can use? And then how can we create opportunities in step 2 between knowledge producers and users and knowledge mobilizers to discuss and debate that knowledge and see how it can be shared, both the research evidence, but also the other types of knowledge. And then how then do we make in those conversations that evidence fit for purpose in step 3? So how do we localize and tailor it to the context, for instance, in local government? And that then leads to step 4 about supporting the uptake and implementation of research evidence. And that's all about relationship building, which we touched upon in the breakout sessions as well. So the way we've sort of done this within Fuse, if you look at those 4 steps, is first of all by having an active communication. We've employed a communications manager, Mark Welford, that you all know. He couldn't be here today, he's on annual leave, but he's very active in awareness raising through the Fuse website, newsletter, social media, blogs. A great way of raising the profile of research evidence and other types of knowledge. And then the knowledge sharing is something like we do today. The QRMs are a key vehicle within Fuse to bring together policy and practice partners, community members and researchers to talk about the research and what it means and how we can overcome some of the barriers. Ask Fuse is another vehicle that you might be familiar with. And for instance, the South Tyneside Best Out in Life project was a project that came through Ask Fuse as a rapid response and evaluation service. And that sort of also takes it into step 3. So it's how do you make that evidence fit for purpose by having a knowledge exchange broker, and we've got like myself, but also like Leslie working in the Ask For You service to really sort of help and tailor evidence to local context, and facilitate and broker those accesses to wider partnerships and relations. And embedded research is also a very important vehicle that we talked about lots today, and particularly Mandy Cheetham has done a lot of work on this and published extensively if you're more interested in some of the deeper insights. And last but not least is then the supporting epic implementation, and that's is about capacity building. It's about training, about how do you do this translational research work, how do you work in co-production, how do you link up different knowledge exchange activities in the different steps effectively to support uptake and implementation. And Ian already touched upon some sort of underlying principles, and I just want to reiterate and highlight some of them from the FUSE model, and they I think align well with what Ian was talking about, in that there's multiple types of knowledge that are used differently across contexts, and being aware of that allows you then to share that expertise across different boundaries, both professional, organizational, and sector boundaries, so primary care, secondary care, to be, and in that sharing, you will be able to get knowledge into practice. And that's very much a social process. So it requires, and we talked about trusting relationships and building those relationships and maintaining them. And that's really almost a full-time job. So the opportunities for knowledge exchange require constant attention, need to be actively created and fostered over time, and it's not something you can do on the side or quickly at the end of a research project. And realizing in that sharing of knowledge is not sufficient for impact, so it's all those other steps that also are required, such as support and capacity building, and understanding local context. And in that, we need new ways of producing and using evidence, such as embedded research and working in co-production. And those are really exciting areas within FUSE that we would like to develop further. There's even an embedded research network meeting going on as we speak now within FUSE. One way of sort of applying those principles and that model is something that's been developed within the School for Public Health Research, where they came up with a set of knowledge sharing principles. So at the start of a research project, at the very early stages when you have an idea, these are some questions you can think about to really think about how can I do this collaboratively and how can I apply knowledge exchange approaches in this. So it's clarifying your purpose and knowledge sharing goals, identifying your knowledge users, and then design the research to include those knowledge users in that process and to benefit from their expertise and knowledge. And be clear about your expectation. Expectation management is often overlooked in that process, as is sort of the monitoring and reflecting on knowledge sharing activities. So how well are we doing? Do we know where we're achieving our goals that we set out in step one, to finally then leave a legacy? So how can we develop, capture, and sustain any benefits beyond the funding of a research project? And thinking about these questions from the early start really helps to identify some opportunities for collaborative research going forward. So I would like to leave you with a few thoughts in terms of where next, what are the lessons we've learned within FUSE, where would we like to go next in terms of developing collaborative research. And what we really like to do, and this is something that Emma Gibson touched upon in her presentation, is sort of that creating of shared spaces, collective spaces for reflection between local government and partners on research evidence and how to mobilize and apply it in their local context. And then also co-produce that knowledge in context, for instance, through embedded research, and develop new and evaluated methods for doing that. We mentioned briefly, I think, online ethnographic methods in the chat. And also builds capacity for sustaining evidence use. So you building an infrastructure in local government, this was mentioned in the discussions, there's not much capacity currently, and there's a lot of focus from NIHR currently in funding programs and applications in building that infrastructure, and that includes knowledge brokers, but also research fellowships and honorary contracts, and that hopefully will give more capacity for doing this type of work. And last but not least, also develop the knowledge mobilization skills among academics. Academics are really quite poor in doing this type of work, and there's not much attention in the curriculum and training of academia to support knowledge mobilization, and therefore providing those opportunities is really helpful in taking this forward. I'd like to leave you sort of with a cartoon. Probably you've seen this one before, but I think this really sums up the key of collaborative research, that whatever we do as academics, decisions will be taken in local government, but our job is to make them good decisions by producing the research and evidence collaboratively for that research. So thank you very much for your attention. Here's a few references if you're interested in reading up some of the things I mentioned. But at this point, I'm going to say thank you and open the floor for any questions.
Thank you very much, Peter. We have 2 minutes for questions. So if there's any burning questions, please feel free to either put something in the chat or just to shout out. I don't know if, Peter, you saw there was a few comments. Pascal loved your knowledge exchange model.
That's nice to know. Thank you, Pascal.
As did Ian. So are there any questions for Peter or any other last thoughts or comments before we conclude? Nicola?
Peter, just interested in what you were saying about the embedded research and network, and maybe you could say a little bit more about that and how people might get involved if they want to.
Yes, absolutely. So there's what we started to do with the translational research program in Fuse is create a network nationally of embedded researchers in local government, and because we were aware of various people working in this way, but they're operating sort of quite on themselves and lonely. And so the idea was to bring them together to share experiences and expertise and use that to build sort of a community of practice around how we can support embedded research going forward with local authorities, and also engaging with funders and local authorities and university on this. So there's a network that this second meeting is happening as we speak. It unfortunately clashed with this meeting, but there will be future meetings, and I'm happy to share details on those if people are interested. But that might be a good forum to share your experiences around embedded research and learn more.
So can people just contact you if they want to be?
Yes, feel free to drop me a line. And I mean, we've got plans to set up a website and things, but that might take a bit of time. So if you drop me a line, then I'll definitely be back in touch and share some details. Thank you, Nicola, for mentioning that.
Excellent, thank you. And I think as well, Anna was asking is there for academics or for people in similar, is that for academics or people in similar roles?
It's for both. So it's in a sense people that straddle both, that from academia, work as embedded researchers in local government, but also local government practitioners spending time in academia through honorary contracts. And it's sort of that boundary spanning role that we're interested in. So whatever way you perform that role, we're interested in learning more.
Excellent, thanks, Peter. So if anyone's interested in finding out more, send Peter an email. Okay, and then just to conclude, sorry, I'm just going to share my screen. I just want to advertise the next Fuse event that will be coming up on the 9th of September. If anyone is interested, registration will be opening soon, so check on the Fuse website for this event and other events that might be of interest. And then just finally, I want to thank all the speakers, so Zoe, Anna, Emma, Peter, Ruth, and Ian, as well as Meg. So thank you all for taking the time to share your experiences and your findings, as well as the Fuse team for organizing the events, Leslie, Laura, Cheryl, and Mark, and to thank, of course, everyone for attending. So thank you, everyone, and that's it.
Right, thank you very much, everyone. Nice to meet you, and thanks for chairing, Heather.